Hello Dragons, my name is Sarah and these are my fellow co-founders Brendan and Alicia. Thank you very much for having us here today. We are representing JAWS, Juvenile Arthritis Water Sharks, and our passion is improving the quality of life for children suffering from juvenile arthritis, or JA, through our structured aquatic programs.
JAWS has the goal of providing children who suffer from JA with 8-month aquatic programs targeted to improve their range of motion, gait, balance, and functional mobility. All children under the age of 16 presenting with signs or diagnosis of JA are eligible. However, participants must have a physician's referral to register. We are asking for $2.5 million for 50% of the company to help us take our initiative to the next level. The funding we are seeking will go towards covering the costs of training for our 5 instructors to facilitate the classes, estimated at $250 per instructor, to increasing public awareness through advertisement and promotion of the public awareness through a $30,000 media campaign, as well as for the purchase of some of the more elaborate equipment necessary to administer many of the treatments.
Underwater treadmills cost roughly $4,000 each, as we would like to start with around 10. Construction of the custom rehabilitation pool have been quoted to cost $100,000, excluding the building lease fees. The current market in Waterloo, Ontario suggests that a building large enough to accommodate this operation, such as the Waterloo Memorial Recreation Complex, would require approximately 1,000 square meters and lease for approximately $195 per square meter, as we would like to extrapolate to almost $2.3 million for 10 years. Registration for JAWS will cost each participant $320 per 8-month session, and we would like to subsidize 20% of these costs for the first year registrants, so their fee is reduced to $256.
Juvenile arthritis affects 4 out of every 1,000 children. It is a long-term, chronic condition in which one or more joints become inflamed and causes limitations in joint mobility, resulting in a significantly decreased quality of life for this population. JA is commonly diagnosed when a child is presenting with joint pain and a limp and/or swelling in 1 or more joints for at least 6 weeks.
Juvenile arthritis can go into remission. However, the more common course of action is for it to develop into adult arthritis. According to Helmick and colleagues, adult arthritis is the leading cause of disability and is among the primary conditions causing work limitations. Arthritis reduces people's occupational and participation abilities, as well as causes severe pain and decreases one's function abilities. Also, CBC News states that arthritis costs the healthcare system $33 billion a year via direct and indirect costs.
Currently, JA is underreported, and the diagnostic process and available treatments are inconsistent across medical professions. To reduce the social, economic, and health burdens that arthritis puts on society, we must shift our focus to the early onset of arthritis and hopefully cause improvements in the pain, balance, gait impairments experienced as a result of JA.
JAWS is an aquatic therapy intervention delivered as modified group swimming lessons organized into classes by patient age. The program offers graduated levels designed to challenge each group with weekly progressions in intensity and difficulty. Each level spans 8 months, in which the participants will attend hour-long classes twice a week. As previously mentioned, the program consists of graduated levels, and it is expected that the participants will return to continue with treatment at the next progressive level. This is upon instructor recommendation or until the age of 16.
Classes are individualized to participants' need, and trainers are required to complete an aquatic instructor's course offered through the local Arthritis Foundation. Classes are designed to include 50-minute warm-up phase of low static stretching and lower extremity joint movement in all planes, a 30-minute workout using underwater treadmills, resistant jets, and parallel bars, and 15 minutes of free play and class water games.
Studies have reported aquatic exercises performed in a group setting have shown to be an enjoyable and beneficial part of therapy for children with arthritis. The water setting decreases stress and load placed on weight-bearing joints and allows for increased movement. Research performed by Bacon and colleagues implemented a similar aquatic program, and that therapy resulted in significant increases in the range of motion in lower extremity joints and a slight improvement in the cadence and stride length of participants' gait. Lower extremity range of motion was measured before and after aquatic exercise, and increases of a minimum of 10 degrees were observed in hip and knee flexion, hip rotation and extension, and ankle plantar flexion. Gait changes occurred with an increase in cadence by 12 steps per minute and improved balance through an increase of 2.4 seconds in length of a left leg balance test.
We are very dedicated to this cause. Indirectly, we would like to see this program assist in raising awareness and funding for juvenile arthritis research.
Our aim is to help the children suffering from arthritis pain to live a better quality life and reduce their overall impairment so they can eventually participate fully in the same activities as children without the burden of juvenile arthritis. Thank you, Dragons.